Definition of healthcare regulation. These are rules that are used to clarify definitions, authority, eligibility, benefits, and standards. Their development is shaped not only by the law, but also with the ongoing involvement and input of professional associations. Examples of such associations are American Nurses Association, the NNA, third-party payers, consumers, and other special interest groups. What healthcare regulation does? It shapes all aspects of America's healthcare industry, from the flow of dollars to the communication between physician and patients. It is the engine that translates public policy into action. How does healthcare regulation come about? Agencies create regulations known as rules when Congress provides the authority to do so. The public plays an extremely important role in the rule-making process by commenting on proposed rules. ANA reviews regulations of particular interest to the nursing community, analyzing them and identifying concerns. Implementation of healthcare regulation. Through various regulatory bodies, the Department of Human and Health Services, HHS, protects the public from a number of health risks and provides programs for public health and welfare. The Centers for Medicaid and Medicare, also known as CMS, founded in 1965, oversees most of the regulations. CMS provides government-subsidized medical coverage through a number of programs. Programs for subsidized medical coverage under healthcare regulations are Medicare for the elderly and disabled, Medicaid for lower-income individuals and families, State Children's Health Insurance Program for health insurance coverage for children under 19 years old. There are other programs that the healthcare regulation regulates. CMS is also responsible for ensuring compliance to the Health Insurance Portability and Accountability Act, also called the HIPAA. HIPAA is a major piece of healthcare regulation instituted to improve the efficiency and effectiveness of the healthcare system. There is also the Agency for Healthcare Research and Quality, also falls under the auspices of the HHS, that is the health system. It conducts research aimed at improving the quality of healthcare, reducing cost, and addressing patient safety errors. Non-profit organizations such as Joint Commission on Accreditation of Healthcare Organizations, the JCAHO, focus on ensuring that healthcare organizations provide quality care. They also employ a system where they give scores between 1 and 100, with higher scores being better. The scores are important because it is a factor for reimbursement from Medicare. The National Committee for Quality Assurance, it ensures the quality of America's managed care plans. Other public health care regulations in addition to the CMS programs are the Food and Drug Administration, the FDA, and the United States Agency for Toxic Substance and Disease Registry that responds to hazardous threats. Function of the regulatory bodies. What do these regulatory bodies do? What do they do? These regulatory bodies monitor healthcare practitioners and facilities, provide information about industry changes, promote safety and ensure legal compliance and quality services. Healthcare bodies, state, federal often establish rules and regulations for the healthcare industry, and their oversight is mandatory. Healthcare policy, what is it? How does it tie in with the healthcare regulation? Policy determines or assists in decisions of every aspect of healthcare, including how it is delivered, setting of care, quality of care provider qualifications, payment level, type of servicing and access to care. Policy and regulation influences a number of things. They influence the practice environment, influence workplace safety, licensure, certification, accreditation, educational funding. We already saw this above on some of the things that healthcare regulation does in the healthcare system. Healthcare finance. The Department of Healthcare Finance is to improve health outcomes by providing access to comprehensive, cost-effective, and quality healthcare services to the residents. Cost of healthcare is higher in the United States than in other countries and a strain on the overall economy. Healthcare finance continues. This higher cost does not translate into better health. It is therefore paid for by government programs, Medicare and Medicaid, as we saw above. It's one of the regulatory bodies. Private health insurance plans and the person's private plans. Examples of Medicaid and Medicare coverage in DC. An example of Medicaid and Medicare in DC. DC Medicaid is a health care program that pays for medical services for qualified people. It helps pay for medical services for low-income and disabled people. For those eligible for full Medicaid services, Medicaid pays health care providers. Providers are doctors, hospitals, pharmacies who are enrolled with DC Medicaid. DC Medicare is a federal medical health insurance for people aged 65 or older. Certain people younger than 65 can qualify for Medicare too, including those with disability or kidney failure. The program helps with long-term care. Medicare has 4 parts. 1. Hospital insurance. It helps pay for inpatient care in a hospital or skilled nursing facility. 2. Medical insurance. It helps pay for doctor services and many other services not covered by hospital insurance. 3. Medical Advantage. Plans available in many areas. 4. Prescription drug coverage. Pays for medication. Important to nurses. It is important for each nurse to understand how members of the largest healthcare profession can influence policy and regulation to improve the health and well-being of society. The nursing practice environment is the hospital, community-based, and is regulated by the types of services offered. This is the end of my presentation. Thank you.